Autopen 2 is the latest Autopen from Owen Mumford, with several additional features to benefit the user. As in previous versions of Autopen, the side-mounted release button provides automatic insulin delivery, which means the user requires much less effort to inject than with all the manual plunger pen devices. Use of the side-mounted release button also creates a more stable and comfortable injection, as there is less movement at the injection site. New features of Autopen 2 include a maximum delivery dose of 72 units delivered in 1 unit increments. The dose correction button enables you to correct the dose setting should you accidentally overdial your dose without wasting any insulin. The new clear cartridge holder now makes it easier to view the cartridge and how much insulin is remaining. The identity rings are an ideal way to distinguish between different insulins used with more than one Autopen 2. Before using your Autopen 2, you should familiarise yourself with the components: dose selector, dose correction button, pen body, dose window, release button, identity ring, pen cap, cartridge holder, internal plunger, rewind collar, cartridge, pen needle and protective cap. Remove the pen cap and unscrew the pen body from the cartridge holder. Check to ensure the dose window reads 0. Ensure the internal plunger is fully retracted inside the rewind collar. If the internal plunger is extended, rewind it by turning the white rewind collar until it comes to a stop. Load the insulin cartridge into the cartridge holder with the metal cap first. Screw the cartridge holder and pen body firmly together. Your Autopen 2 is now ready for priming. If your cartridge contains an insulin suspension, for example it may have a cloudy appearance, turn the pen up and down at least 10 times as per cartridge instructions. Using a new pen needle, remove the protective seal and screw the pen needle straight onto the cartridge holder. Remove the outer protective cap and needle shield from the pen needle. Before using your Autopen 2, it is important to remove any air that may be inside the needle or insulin cartridge. Dial 2 units on the dose selector. Hold the Autopen 2 with the needle pointing upwards. Push and hold the release button until the numbers on the dose window return to 0. Repeat this procedure until a drop of insulin appears at the needle tip. You should repeat this procedure before each injection. Your Autopen 2 is now ready for use. Check to ensure the dose window shows 0. Dial the number of units required. Each line on the dial represents the next odd number in sequence. If you overdial your required dose, you can correct your dose by using the dose correction button located on the top of your Autopen 2. This will move your dose back by 2 units with each click. If you click back too many units, dial up the units required. Before injecting your dose, check the dose window shows the correct number of units to be injected. Insert the needle using the injection technique recommended by your healthcare professional. Push the release button towards the pen needle and hold it in place until 0 appears in the dose window. Then count to 10 slowly before removing the needle from the skin. If the dose selector stops before reaching 0, you have not received your full insulin dose. The dose window will show the number of units still to be injected. Change your cartridge, then inject the remaining units of insulin to complete your dose. Reattach the outer protective needle cap and unscrew the pen needle. Your pen needles should be safely disposed of in accordance with the advice from your healthcare professional immediately after each injection. With the pen needle removed, unscrew the cartridge holder from the pen body and remove the cartridge. Rewind the internal plunger by turning the white rewind collar until it comes to a stop. It is important not to over-rewind it. Load the insulin cartridge into the cartridge holder with the metal cap first. Screw the cartridge holder and pen firmly together and proceed with the priming of your Autopen 2 prior to injecting. Having changed your cartridge and primed the Autopen 2, always remember to inject any remaining units of insulin if necessary. After injecting your insulin, you should always remove your pen needle using the outer protective needle cap, then replace the pen cap on Autopen 2. Used pen needles should be safely disposed of immediately after each injection in accordance with the advice from your healthcare professional.